Hello everyone and welcome back to As Told by a Nursing Student. Today we are going to be talking about the different heart sound points or heart sound locations. I'm going to be going over 4 different locations today, and these will be good to know if you're doing a focused cardiac exam on a patient. Perhaps your patient is taking some kind of medication that affects the heart rate and you want a better look and sound at their heart. There are other reasons to use these different heart sound points, but that is just an example. Going into the first site is the aortic site, which is at the second intercostal space, right sternal border. The pulmonic site is at the second intercostal space, left sternal border. Tricuspid, fourth, left sternal border. The mitral or apical site is 5th intercostal space, left mid-clavicular line. I hope this helps. Thanks.